Are you dealing with sciatica and want relief? I'm Dr. Clayton, and I have 3 stretches that are going to become your best friend. Before I introduce you to your new best friends, it's really important that you understand these 2 concepts. The first concept is that nerves don't like being compressed or being pulled on. So if you're trying to stretch your lower back or your hamstrings and you have this massive pulling sensation all the way from your back down your leg, stop. It's just going to prolong that healing process. That means you're tugging on your sciatic nerve and it's going to get pissed off. Second concept, understanding the difference between centralization and peripheralization. While we're doing these stretches, our goal is for centralization. We want that pain to start to isolate into one area in our lower back. If you start to experience peripheralization, stop. That is when the pain starts to radiate further down your leg. That means your nerve is getting more irritated, and when you go to stand up and move around, you're going to be pissed off because you're going to be in more pain. Remember, the goal is centralization. Get that pain to isolate into one area. Now, let's introduce you to your new best friends. I have a feeling the third one is going to be your favorite best friend, if you're allowed to say that. But if you can do the exercises in the order I'm going to show you, you're going to get the best results. The first stretch is going to be to help flush the inflammation out of your lower back. You're going to start in your stomach, your forearms are going to be underneath your chest. It's really important that you relax your lower body and your lower back. From there, you're just going to rest your chest on your forearms and just press back and forth 10 to 15 times. This is going to flush that inflammation out, giving your sciatic nerve more room to move, giving you a ton of relief. As you can see in this diagram, there's a little muscle in your hip called your piriformis that can sometimes pinch that sciatic nerve. So this stretch is a way to loosen up that muscle. You're gonna go on all fours. From here, you're gonna bring the affected side. So I'm gonna use my right leg and I'm gonna bring that leg forward underneath your chest, maybe even between your knee or between your hands. From there, you're gonna take the opposite leg and you're gonna reach back as far as you can and try to sit into this hip. If you wanna intensify the stretch, you can bring the right leg, right foot forward, hold that and just sit into that hip as much as you possibly can. It is really important you keep your back straight. What I don't want is your rounding or going down to your forearms like this. That's gonna put more pressure on your back, irritating that sciatic nerve. So keep that back straight, sit into that hip, hold for 10 to 15 seconds. And if you want to intensify it, like I said, you can bring this leg forward or this foot forward, or you can bow forward, but keep your back straight the entire time. Enjoy that stretch and get pressure off that sciatic nerve. For this next stretch, it's really important that you remember those 2 concepts we went over in the beginning of the video. No pulling sensation down the leg and no pain radiating down the leg. Make sure you avoid those with this stretch. If you start to feel that, just do a little bit less range of motion. Oh, and I forgot one thing. Don't forget to hit that subscribe button. It'd be greatly appreciated. Now, let me show you the stretch. So what we're gonna do is you're gonna straighten your leg. Don't do it yet, just so you can understand this concept. You're gonna straighten your leg and you're gonna point your toes up towards the ceiling. What this is gonna do is gonna pull the nerves from your lower back down this way. We're also gonna incorporate your head. When you tuck your chin to your chest, it actually pulls the nerves from your lower back up towards your head. And then as you look up towards the ceiling, it allows the nerves to glide this way. So you're gonna start on your non-affected side. My right side is the side that has a sciatica, so I'm gonna start on my left. You're gonna go toes up, nose up. So as I straighten my leg, my toes are gonna go up and my nose is gonna go up. What this is doing, it's allowing those nerves in your lower back to start to glide back and forth past that inflammation, which is irritating that sciatic nerve. You're gonna do 10 to 15 on one side, on the non-affected side, then you're gonna go to the affected side. It's really important on this side that you don't feel that stretch, okay? So, as your toes go up, your nose is gonna go up, and even if it's just a small range of motion like this, that's fine. Just go back and forth until you can feel like you can go a little bit further because that nerve is unlocked, not pinched as bad, and then you'll be able to do full range of motion. I promise you, I know you're not gonna feel like anything, but when you get up to go move around, you're gonna feel dramatically better. This is why this exercise or stretch is my patient's favorite one. Those are the stretches my patients absolutely love for their sciatic nerve. If you're wanting more exercises or stretches, I have a whole playlist on lower back pain. I'll put that down in the description below. If you have any questions for me, please reach out or drop a comment. I'd love to help you. Until next time, keep moving and enjoy the rest of your day.